Okay. Namaste everyone and welcome to the new video of VIT Pune. Today we have with us Mr. Varun Jhaveri, and he is currently deputed as officer on special duty to the National Health Authority. And Varun sir has worked with a lot of other institutions before serving as an officer on special duty. He has worked with NITI Aayog, he has worked with University of Chicago, he has worked with the United Nations. And Varun sir, we are extremely happy to have you here on today's live stream. Um,
Thank you, Aditya, and thank you, VIT Pune everyone for hosting me. I welcome all the viewers. Thank you for joining us today.
Yes. So for our viewers, I'll just give you a brief context of how this interview is going to be. It is less of an interview. It is more of a conversation between both of us, and we are going to steer this conversation from a macro policy towards a micro policy. We're going
Hmm.
to first talk about the center's response, then move on to the center-state coordination, and finally to some very crucial topics which India needs to now adapt is like mediclaims and public health insurance policies and so on and so
Hmm.
forth. So Varun sir will start with the first question. Um, there was a study done by many Indian universities as well as Indian institutions which have said that our initial response in terms of quality could have been better, that we started screening people for temperature on airports, but the quarantine facilities and these came pretty later. uh, would you say that government of India could have been more proactive as to how could it respond to coronavirus or COVID pandemic?
Sure. So, Aditya, when we look at retrospect, any particular intervention, any particular policy that has been implemented, always have areas, which could have been implemented in a better way. And this applies not only to India but across the globe. So, of course, everyone would be having different observations, different recommendation, and I think all of those recommendations are very much valuable. But if you look at the facts, I think India was one of the country which actually responded as one of at one of the most early moment when we started the thermal screenings at the airport. When we started building the quarantine centers, especially for the airport travelers, when we put out guidelines about how travelers from various countries, they need to go into a quarantine. We recognize those particular countries. I still remember that how different doctors and different hospitals, especially in the metro cities, they were trained and they were provided support with regard to clinical protocols about how to handle the travelers who are showing the symptoms. So I think we did a lot of capacity building, and we did react quite early, and I think we were quite proactive in the entire setup. But again, saying that, I do agree to the fact that of course there are various areas, because the management of COVID, as we have realized in this last 4 to 5 months, it is not just a management of one or two different aspects. It is a management of various facets, including the clinical management, the logistical control, the contact tracing, behavioral change, taking preventions. So all of these things, how to bring them together, how to engage all stakeholders in this particular management, I think that is very critical. So, of course, there would definitely have been, one or two gaps. Of course, things could have been better. But I think as an early response, India was very proactive. And I want to especially highlight the fact that if we would not have been so proactive in the early days, things would have been very different than what they are right now.
Yes. Varun sir, you rightly mentioned about the response from all these stakeholders and bringing them together.
Hmm.
I would like to ask what stakeholders did Government of India identify in its initial response that they should be first responders to this situation?
So, Aditya, let's try to envision this entire scenario into three different stakeholder buckets. And of course, their stakeholders are are quite beyond that, but I'm just going to focus on the key, key stakeholders. The first and foremost are the citizens.
Right.
When you talk about the citizens, what happens in COVID is that it is a particular virus which gets transmitted from one infected patient to the other. It is not something which is getting transmitted through water or particularly through air, but it is more from a patient to patient. So the first and
Right.
foremost stakeholder that becomes actually very important to inform is the patient and the citizens. Now, what the government started from very early days was a lot of awareness. If you remember, the formidable step was taken was to partnership with the Department of Telecommunication and all other telecom operators, wherein
Yes.
if you are calling any person across anywhere in the country, you
Yes.
used to get this corona message. Now,
Yes.
things like this is actually not very important for people who have access to social media or media, but for
Right.
people living in rural areas, in far-flung areas, this is a very, very critical message. So number one is that. Number two is that from every particular position of responsibility, the message was delivered about how this is a very dreadful virus and how precautions needs to be taken. From the post of the Prime Minister till the ASHA worker who is a frontline health worker, every
Right.
particular stakeholder engaged at every step was delivering the message of taking precautions. So I think that was a very, very critical aspect of how this citizens were engaged and how they were asked to maintain this precautions. Stakeholder number two is actually the providers of the care, the doctors and the hospitals and the health workers in general. Now, they are the ones who actually have to do a lot of heavy lifting,
Right.
whether it comes to the treatment or whether it comes to the testing. So in that particular aspect, what the government started doing is, because there were no established clinical protocols. Of course, it is a severe form of influenza. Its treatment is similarly to how we are treating a very high risk pneumonia or a very high risk severe acute respiratory illness. But there is no particular clinical protocols which are there. So,
Right.
India, looking at other countries, we developed the clinical protocols. We started training doctors. We started training our nurses, our frontline health workers, and we started informing them about how to actually, test this patient, how to, it is a very complex process, like, collecting the swabs, storing them, testing them, reporting them. It's a very complex process. And I might not be doing justice by just saying, but just want to
Yes.
put it out that it's fairly
Yes.
complex. So when it comes to testing, then when it actually comes to triaging, now triaging is something which is very critical.
Okay.
And what exactly does triaging mean is that when you are at a hospital floor, you will be getting multiple people, and I'm talking about COVID positive people. There would be
Right.
patients who would be at a lower risk of severity. You are COVID positive, but probably you are not showing any particular symptoms, so you are either asymptomatic or you are someone who has very less symptoms. So what to
Yes.
do in that case? Should we give a bed to them? Should we ask them to admit or not? Then the second category is someone with a moderate risk. Someone who has a fairly
Right.
high severity in terms of one particular symptom. You have either very high fever or you have very high cough. What to do in that particular patient? And the third
Mm.
one is the riskiest one, which is a patient who has high symptoms, but at the same time also has some sort of a comorbidity. So what we have
Right.
witnessed is patients, let's say having high blood pressure, or patients with breathing problem,
Mm.
with COPD or asthma. So these patients, they become a very highly risk patient. So
Mm.
when you have these three different types of patients who are coming to hospitals, have to
Mm-hmm.
make that decision that who will get what bed, what
Yes.
is the treatment regimen which needs to be followed. So this is the triaging, and this is something that there was a lot of capacity which was built, because the government of India can't suggest that how to
Yes.
triage patient by patient. It is the
Right.
doctors who need to take this call.
Absolutely.
So and at the same time, a lot of training through online modules was given to ASHA workers,
Mm.
how to go, because they are the hands and feet and eyes at the village level, about how to
Absolutely.
ensure that people at that particular levels, they are getting that awareness. So a lot of
Mm-hmm.
training was done at that level. And the third one, the third stakeholder, which is a very critical stakeholder, are the ancillary institutions like the government setup, training your government officials, training your health departments, health ministry staff, at the same time training other institutions which are going to help in that, such as your insurance companies, your medical devices manufacturing, your medical consumable manufacturing, so a lot of stakeholder consultation was done. A lot of orders were placed, orders such as N95 mask, PPs, and
Yeah.
there are various success stories which have also come out of that. And I
Yes.
would highlight that as our conversation moves on. But these are the three major stakeholders that were critically informed, and they were critically engaged right from the start of this pandemic.
Uh, Varun sir, you mentioned about capacity building and
Hmm.
how these things were very necessary because we did not have a standard operating procedure in terms of dealing with this kind of virus. And a few days back, government officials had said that lockdown was essentially, you know, lockdown was essentially placed because the government and the health infrastructure needed the time for capacity building, and
Hmm.
that raised many questions on the effective or non-effectiveness of the lockdown. So, what would you say about how much or how much not the lockdown was effective?
So, without speculating, I'm just going to put, certain facts with regard
Okay.
to the effectiveness of lockdown, and, how it was important and what type of role it played. So, the first and the foremost fact that we need to understand is that, the COVID virus, and for that matter, any particular virus,
Mhm.
the rate of transmission of that
Mhm.
particular virus is defined by something called R naught. Now,
Mhm.
this R naught is nothing but what is the type of rate of spread that through which this particular virus is getting spread. If I have to explain in a very layman language, it means that how many people will one particular COVID patient affect. So
Okay.
that is what R naught is. So
Mhm.
before lockdown, the R naught was somewhere around 1.85, and
Okay.
after lockdown that R naught got decreased and it became to 1.23. So I think that itself is a commendable decrease, and that solely happened because of the type of lockdown. Of course,
Mhm.
the effect of that, it differed from state to state depending on how religiously the lockdown was followed or implemented. But overall, this zero point 0.6 decrease that happened in R naught, I think that
Mhm.
itself was a quite a big achievement. Also, the thing is that if we had continued with the same R naught, we would have reached 1 lakh cases, way before in April start itself.
Yes.
And the lockdown started in 25th March. So with that R naught, probably we would have reached 1 lakh cases sometimes in the first week of April itself. While if you
Oh
look
my
at
God.
what happened after lockdown,
Mm.
we reached that 1 lakh mark way later. And this R naught is the one which we really need to decrease. So what it says is that when R naught goes below 1, the curve starts flattening, which means that when we actually talk about the flattening of the curve, that means that the cases, the cases at which the active cases and the rate at which they are growing, they have fallen. So
Right.
when that rate of active cases becomes negligible, that's when the
Mhm.
curve starts flattening. So that is point number one.
Mm.
Point number two is what you mentioned, Aditya, with regard to the building capacities. So you know let me highlight two different points. First
Mm.
is with regard to the testing, and
Mm.
then the second point is with regard to the treatment. So when we talk about the testing, when we started this particular COVID testing, the COVID testing process involves various components. Number one is the swabs. Number two is building capacities about how to do the test. Number three is actually doing those particular tests in different laboratories. Number
Mm.
fourth is how to dispose the samples after efficiently collecting them. And number fifth is reporting. So
Mhm.
as I said before, it's a very long process, and
Right.
you need to ensure that you are following all the standards.
Mhm.
When we started this particular testing activity, India was testing somewhere around 8,000 to 10,000 samples. Today India is testing 2 lakh samples per day. So that 10x capacity increase which has happened, it has solely happened because India took that buffer time. And
Right.
in a country of 1.35 crore, 135 crore people, you need some time to build that capacity, because no country in the world is actually ready for managing such type of pandemic within, like, within a week or two. And that particular lockdown, it gave us a lot of time to actually train our doctors, reserve a lot of beds, dedicate COVID hospitals. Because
Hmm.
one thing that we need to understand is that you cannot have all the hospitals treating COVID. You need to have dedicated
Absolutely.
hospitals, and you need to reserve beds, because the place where COVID patients are getting treated, you cannot have other patients come in.
Right.
So you need to have dedicated infrastructure for that. So the first one is with regard to the whole testing part. The
Mm.
second one is with regard to the treatment part. The bed reservation that I said. But at the same
Hmm.
time, there were a lot of other things such as PPEs, masks, which were required for the doctors. So
Hmm.
if you look at what was happening, before the lockdown, we used to import PPEs from outside India.
Right.
And we imported PPEs from across the world, because we did not have any particular capacity. In
Hmm.
this 2 months of lockdown that happened,
Hmm.
we built internal capacity to such an extent that today India is the second largest PPE manufacturer in the world. We are manufacturing 4 to 5 lakh PPEs per day. And this PPEs are first of all getting used in the Indian in the Indian hospitals and testing labs. But at the same time now, in some days, when the supply is going to exceed our Indian indigenous demand, we are soon going
Right.
to start exporting it. So it
Mm.
shows the type of capacity which was developed in these 2 months. A lot of
Right.
us think that India had completely stopped. No work was happening, but of course,
Mm.
India had stopped, but there was a lot of work which was happening at the background, which actually ensured that the system,
Hmm.
the entire health system was ready to actually deal with a pandemic like this. So that is
Right.
the point number two. So we have discussed the rate of transmission, and then we have discussed the type of capacity building which happened. The
Right.
third point, which we actually completely ignore the fact, is the
Hmm.
type of rapid behavioral change which has happened among citizens in
Mm.
these 2 months. Because of the lockdown,
Hmm.
every citizen understood what is the type of risk and what is the type of severity which is associated with this virus.
Hmm.
Now, if you go and if you step out of your house, you will see every single person wearing a mask. You will
Right.
see every single person, adopting hygiene standards. You know, behavioral change, Swachh Bharat, it started somewhere in 2014. It took,
15.
it took a good 5 to 6 years for people to start adopting different behavior. But because of this 2 months lockdown, and people understanding the severity of this particular COVID, there was an instant behavioral change which happened. And this is the most critical part. If that behavioral change wouldn't have happened, if people would not have conformed to hygiene standards or using masks, that rate would not have decreased, and it would
Right.
have been a major burden on the entire system. So these 2 months were not merely a lockdown, but it was a period that the government utilized for undertaking various important aspects which massively help India today in dealing with this pandemic management. So, in and all, if I look back, I think the lockdown was a very important intervention. And of course, a lot of discussions can happen that whether that lockdown should have been, 2 months or, 45 days, some say 75 days. But this is where the discussion, and of course the discussion and debate should happen. But I think this lockdown was very important overall for the management of this pandemic.
Yes. One point which I very much want to emphasize on, which was on the testing part, was the disposal of all the PPE kits, masks, and swabs used for COVID
Hmm.
patients and their disposal management. India overall does not have a very adequate infrastructure when it comes to normal disposal of medical, post-medical treatment things. Now we
Yeah.
have to be very careful because these disposed PPE kits and masks can not only affect the environment, that is a completely new dimension of this problem. But the
Hmm.
problem is that we also need to have adequate infrastructure to dispose of the particular COVID PPE and COVID medical objects. What would you say on that?
Yeah. So that was again one of the very key important topic, which was actually thought by the government, and strict guidelines were drafted and communicated to all the hospitals about how this particular consumables and equipments which are involved in the COVID testing and treatments needs to be treated as a biomedical hazard. And when you treat any particular waste as a biomedical hazard, what you do with regard to the disposal is the incineration. So you cannot
Right.
store them and let them pile up in the in your landfills, like how you do
Right.
with your normal non biodegradable substances. Because if they do, that itself is like a living mountain of hazard. And
Yeah.
in this particular case, it was communicated very strictly that all the particular waste needs to be handled in a particular manner, similar to how they were handling their syringes before, because
Right.
syringes are again an example of a biomedical waste. Point number two is that there were several different agencies,
Hmm.
which are actually contracted for this by various hospitals, whose main aim is to collect this particular biomedical disposal waste and take them to the landfills for actually getting incinerated. So a similar type of a protocol was followed. But I think this particular piece is something which is very new, not only to India, but to the world. And,
Right.
the extensive use of plastic and non-biodegradable substances in masks, in PPE, that is something which needs to be, severely looked at. And probably I know that there are several discussions happening. I had got a chance to be a part of one of that, United Nations Environment Program was doing, about how to actually come up with a framework for safe disposal of such type of biomedical waste.
Right.
So there are a lot of thought processes which are happening,
Mm.
and I think it's a very important area that all of us needs to actually think about. We need some solutions for this. I think right now what we have is more of a makeshift solution, but we need
Mhm.
more of a sustainable solution to tackle this.
Yes. Uh, and going with the previous answer about how we can manage this problem sustainably,
Hmm.
another negative externality of this lockdown was what we saw as a mass exodus of the migrants from the metropolitan areas to their villages areas, and this kind of poses two questions. One is there no safety net for migrants when we have any kind of crisis, not just now, but any future kind of crisis? And
Hmm.
second, is the excessive urbanization which we are facing right now, because so many people, there's no cross migration. The migration is unidirectional and it's from the cities to their own villages. So, addressing the first point, do we have no safety net in terms of survival and sustainability for the non-registered informal workers, as we say them in legal term, to survive when almost everything is shut?
That's a of course a very interesting area of discussion. But let me put out my particular perspective on this. I think the day when the Prime Minister announced the lockdown, the very next day the government announced the Pradhan Mantri Garib Kalyan Yojana package.
Yes.
And this PMGKY, the abbreviation that we know of, that announced a 1,70,000 crore
Mm.
direct money transfer to the poor and vulnerable families, which comprises migrants. So when we
Mhm.
talk about the safety nets, how this particular PMGKY package has actually been a big boon, we need to understand that.
Mhm.
In the last 2 months, just after the announcement, the government has extensively used the JAM Trinity. The JAM Trinity, which includes the Jandhan account, the
Mhm.
Aadhaar, and the mobile accounts which are linked with this Jandhan and the Aadhaar.
Right.
So, using this Jandhan, using this JAM Trinity, the government started undertaking a direct money transfer. And this particular direct money transfer was directly given to the Jandhan account holders. So, till now, till today, we know that a very huge sum of money has already been disbursed and has already been received by this particular sections of our society, which is poor and vulnerable population.
Right.
The point number two is that there was also a lot of focus which was done in ensuring that the existing schemes, such as the Ujwala scheme for provision of gas cylinders,
Mm-hmm.
other schemes which provides some sort of a subsidy and some sort of a direct money transfer to widows, to Divyang, that was also rapidly implemented. So yeah, the last time that I checked, and I do not remember the date, but the last time that I checked, 45,000 crore was already disbursed within the accounts of this particular citizens.
Mm-hmm.
Point number three is that I think there has been some sort of an economic safety net which has happened through this PM Garib Kalyan Yojana. I think what has really been a tough point for all our migrant citizens has been the logistics part, with regard to going back to their home, with regard to finding a shelter within the cities where they are working, and the normal anxiety that happens, and that happens to everyone. They are no different from all of us. It's just that they are in a position where they do not have the type of resources that others might have. So I think the
Absolutely.
logistics has been a part which has been tricky. But one thing that I can very well assure you is that a lot of these families, they have been receiving this financial support. And Aditya, without this financial support, and of course there has been a lot of support which has been provided by civil societies and NGOs when it comes to delivering food, delivering masks and everything. But one thing is that without any of this financial support, like how it has been portrayed in some outlets, if they would have not got any particular aid, there would have been a massive civil unrest, and
Yeah.
that has not happened. Even in the rural areas, that has not happened, which means that people are getting benefits of various schemes, of various subsidies, and of various direct money transfer schemes which have been announced. So that is with regard to your question, question one. The
Mm-hmm.
question two, with regard to the urbanization, I think that is more of a fundamental problem rather
Mm-hmm.
than an issue which has been triggered by the COVID crisis. What COVID has
Right.
done is that it has basically exposed the
Highlighted.
exactly. It has highlighted the fault line within that models.
Right.
Now, I think a lot of effort has been already undertaken with regard to how to actually start empowering the rural population to ensure that there is a less migration and a lot of people can actually find their livelihood within the rural areas itself.
Mm.
So I think what has happened in India is that after 1947, we had a time, at least for the next 50, 60 years, wherein we had embarked upon a trajectory wherein, it was deemed that the public infrastructure is only the one which actually needs to help people. There was a, lot of inertia with regard to including the private infrastructure, at least till the 1990s.
Right.
And after 1991, when we started actually opening up the markets, a lot of growth only took place within the urban areas. The rural areas were more or less excluded. So we need to understand that the rural areas, they have actually suffered this isolation for a good 50, 60 years.
Mm-hmm.
And that's where the actual divide is, that urban areas, they started experiencing growth, rural areas they did not. And that's why people started wandering to the greener pastures. But I think
Mm-hmm.
now a lot of emphasis has been put on agriculture, and more than that, allied activities of agriculture, which includes things like your sericulture, your poultry farming,
Horticulture.
and all of the horticulture. A lot of modernization is taking place. A lot of credit enhancement tools have been provided. Like if you're a farmer, you can get a particular loan at at a much lower interest. There are Kisan cards. There was a PM Kisan scheme which was launched, which gives direct subsidy and direct cash benefit transfer to the farmers. So I think a lot of these initiatives, if you look at it, is actually concentrated in the rural areas. So what
Mm-hmm.
this particular bouquet of schemes is trying to do is trying to empower the people living in these rural and far-flung areas. So I think if we continue the same trajectory, at
Mm-hmm.
least in the next 10, 15 years, we'll see some sort of equivalence which happens within the growth rate. And I am a firm believer that we really need to empower our rural areas, because that's where the large chunk of our population resides. And I think with the trajectory that we have embarked upon, I think that looks very much possible.
All right. So moving on to the next segment of our questions, which is the coordination between states and center. I think the coordination between state governments and the central government has one of the very crucial points of management of this COVID-19 crisis we have been seeing. We have been seeing some bottlenecks, but we have been also seeing some success stories where the most vulnerable areas like the Northeast have till now limited their COVID patients to bare minimum with the coordination directly from the central government. But what more needs to be done from the central government or the state governments is to be seen. What would be your response to that?
Yeah. So, let us try to understand how this particular coordination work and what is the type of responsibility which happens. Now, the first and the most important point that we need to remember is that health is a state subject. So a lot of infrastructure, a lot of resources, including hospitals, labs, doctors, especially the public infrastructure within a state is actually controlled, owned, and maintained by the state.
Right.
Central at large have very few hospitals such as AIMS or PGI Chandigarh, which are
Hmm.
actually directly controlled by the central government.
Right.
A lot of the resources are actually controlled by the state government. So even in a pandemic like this, what the central government primarily tries to do is that it tries to provide a lot of suggestive guidelines. It tries
Hmm.
to provide a lot of frameworks. It tries
Hmm.
to provide a lot of capacity building. Now, what the state government is required to do is follow the guidelines, but at the same time tweak the guidelines as per their particular required resources. So if you look at India, it's a conglomeration of 36 different countries, and I've been always saying that every state is very different from one another. Of course, it
Hmm.
is bounded by great it's bounded by a great central authority, but every state is so different that it requires some sort of a different model with regard to the implementation, and
Hmm.
that particular different essence can only be brought by the state government. The
Right.
central government can give a rough skeleton, but
Hmm.
the state government, they need to tweak it in a way which is different from each other and which actually suits their particular requirements. Now, if you look at the primary role is that the state, it actually receives a guideline. It basically looks after what are the existing condition and challenges within the states, and based
Hmm.
on that, it takes a call. Even if you look at the lockdown, and when the lockdown was gradually getting eased, different states had different policies. Some said that
Right.
you can open this establishment, others said you can open the other establishment. So for that matter, states are the ones which have a lot of autonomy when it comes to implementation. So as a
Hmm.
point number two. Point number three is with regard to the fact that if you look at the planning, and if you look at a lot of processes which are involved, such as contact tracing, contact tracking, providing the different teleconsultation services, ensuring that the labs in their particular states have have proper capacity to actually undertake testing. All this
Right.
is something which comes under the ambit of the state, and that
Hmm.
is the primary reason why we see different sort of progresses which have been made by different
Hmm.
states and different union territories. Some
Right.
states have done a phenomenal job when it comes to contact tracking, when it comes to tracing the surrounding patients near a COVID positive patient. While some states, they haven't been able to undertake this particular task with similar success rate. The other thing is that a lot of these states, I know that they have done extensive preparation in terms of dedicating different COVID hospitals and reserving the beds and all. And that is really showing up when it comes to the morbidity rate, or when it comes to the type of positive rate of testing to the number of samples which have been tested, and that's why
Hmm.
there are a lot of differences even across the states and their performance. So I think if we have to if I have to just summarize, the central, it prepares and it helps the particular states with different sort of a guidelines with a rough implementation framework, but finally it is the states and the local district authorities which actually needs to undertake this implementation by making sufficient tweaks in that.
Um, Varun sir, you work as an officer on special duty for the National Health Authority.
Yeah.
How has been the role of National Health Authority in tackling and especially giving different guidelines, working with ICMR side by side when it comes to the scientific part and the medical part of the COVID-19 crisis in this period?
Yeah. So, the first and the foremost thing that we did was that we announced that the COVID-19 testing and treatment would be free for all the Ayushman Bharat beneficiaries, and we cover around 55 crore citizens. So that itself, what it did is that it took out, the anxiety of any sort of a financial burden on the poor and vulnerable citizens who cannot afford testing and treatment. So we said that Ayushman Bharat would be covering your testing and treatment either at the public facilities. Public facilities is already free, but even at the private facilities. And we have 22,000 hospitals right now with us, out of which, some of them are COVID dedicated hospital, even in the
Right.
private. So all of them, can offer this particular services to all the
Mhm.
Ayushman Bharat beneficiaries. So that is the point number one. Point number two is, we rapidly empaneled a lot of COVID dedicated hospitals, but at the same time, even non COVID hospitals. So,
Mhm.
we expeditedly ensure that more and more hospitals they become a part of our network. So, we made the empanelment procedure a bit more flexible,
Mhm.
because we needed more hospitals at that point of time. And the one point that we often miss is that with the inception of COVID, the demand and the need for the non-COVID diseases and treatments hasn't decreased. So it is
Right.
not that the people have stopped taking treatment for their heart diseases or for chemotherapy or for dialysis. And
Absolutely.
non-COVID services are extremely important. And in a lot of times they are more life-threatening than the COVID related ailments. So we were very much focused on both the COVID related ailments as well as the non-COVID related ailments. Point number three is that we also started directly empaneling a lot of private labs.
Mhm.
So if you look at our existing model, the model before COVID, we generally used to empanel the hospitals, and then the hospitals, used to have some sort of a contractual arrangement with labs which might be within their hospitals or which might be, outside the hospitals. So it's the hospitals which deal with that, and then we reimburse to the hospitals, and then the hospitals have the contractual arrangement to deal with the
Right.
labs. But in COVID, where testing is such an important component of identifying and in the entire response, we started directly empaneling the labs so that any particular patient, after getting the necessary precaution, can actually go to the lab and can get this free testing in the empaneled labs if he or she is a Ayushman Bharat beneficiary. So
Mhm.
this is the third thing that we did. After that, we have done a lot of other technical activities, such as one example of that is that if you use the app Arogya Setu,
Mhm.
it is also a sort of a triaging mechanism wherein
Right.
you either say that you are at no risk, or you are at a moderate risk, or you are at a high risk. So the
Mhm.
patients who actually enter that they are at a moderate risk or they are at a high risk, there needs to be some sort of a follow up which needs to be done.
Right.
So Ayushman Bharat has been extensively involved in following up this particular activities with the patients who are at a moderate risk or who are at the high risk. And
Mhm.
based on the follow up, then we also help them recommend what is the next plan of action. And we have both non-clinical as well as clinical experts who do this particular follow up. So, of course, there are a lot of things that are also in work right now, but
Mhm.
these are some of the key things that we were involved in.
Varun sir, you mentioned Ayushman Bharat Yojana when it comes to testing.
Yeah,
In few days ago, we saw some news channels covering that how much private hospitals have been charging absolutely higher rates for COVID-19 treatments, and there is somewhere insurance and mediclaim as a sector comes in. And with Ayushman Bharat Yojana, when the provision is that per family 5 lakh rupees for secondary and tertiary hospitalization and care. When this virus is something which spreads from one person to another person and it makes the whole family vulnerable, do you think the government needs to expand the bracket of Ayushman Bharat Yojana now to cover not just families but at least individuals with Ayushman Bharat?
yeah. So how Ayushman Bharat works is that Ayushman Bharat does not pay the hospitals the charges that they want to simply levy on citizens.
Mhm.
Rather, it's a predetermined package rate. So, it is not that if I am going to a private hospital, a private hospital might charge me, let's say, 25,000 per day, for just getting a room for COVID treatment. That's not how, Ayushman Bharat works. Rather, what Ayushman Bharat does is that we enter into, some sort of a arrangement with a hospital with pre-negotiated rates, and these rates are more or less uniform across the country. So it is
Okay.
not that, and these are the rates which are very similar for private and the public hospitals. Of course, there
Mm-hmm.
are some particular differential incentives depending on the quality of care which is provided by hospitals. But
Mm-hmm.
what that leads to is that no particular private hospital can actually make any windfall gains in there
Right.
or do any sort of a major profiteering,
Mm-hmm.
but at the same time ensure that they participate in Ayushman Bharat and provide this particular treatment to our beneficiaries. So when
Mm-hmm.
we are covering this 50 crore plus beneficiaries, we ensure that there is a sufficient volume of beneficiaries which is happening across the country.
Right.
Just to give you a scale, in last 20 months, we have provided treatment to more than 1 crore beneficiaries. And the total, amount which has been pre-authorized has been more than 13,500 crores. And we have 22,000 hospitals which has been implemented in 33 out of
Mm-hmm.
36 states and union territories.
Mm-hmm.
So it's the world's largest publicly funded healthcare program. So the scale is huge. What we try to ensure is that there is a good synergy between the public system, between the private systems, between the government, between the citizens. But at the same time, we ensure that no particular entity is getting any particular windfall gains through this.
Varun sir, will take one last question and then we'll move on to
Sure.
the questions from the viewers.
Yeah.
This last question is very crucial. That what is the aim of the government in the end for the COVID crisis? Is
Hmm.
the aim zero active cases, or is the aim to have a behavioral change in a way that Indians can live freely with COVID-19 existing as a disease now for a long time to come? So the question here is that the aim of the government when it comes to lockdown, quarantine centers, and I mean, how many hospitals and how many quarantine centers can government build? There is a limit to that. Until the vaccine arrives, there has to be some kind of containment. So till the vaccine arrives, again, the vaccine will raise different questions, but we will not go there. Till the vaccine arrives, what is the aim of the government with all this massive exercise about which you are talking about for the past 40 minutes?
Hmm. So, well, I think it's more of a phase-wise approach. If I have to look at it, I think at least in the first phase, the idea is to ensure that the the rate at which cases are growing, that particular rate can get highly subdued, and we can start flattening the curve. Of course, the most idealistic scenario is to make India COVID-free. But again, as I said, it's a phase-wise approach, and the idea is that we start flattening the curve. We start even after flattening, then we start bending the curve, and then we move towards a phase two of more active efforts toward making the country COVID-free. But at the same time, I think what is happening is that there are a lot of indirect consequences, which are very positive consequences, which are happening for the country. Uh,
Mhm.
the first thing is that the level of hygiene standards, they have highly increased, and this is not only amongst people but across establishment. If you look at
Mhm.
restaurants today, if you look at our flights today, any particular establishments, they have, all of them have adopted to many higher standards of hygiene, which wouldn't have been possible in a simple scenario.
Right.
So I think there are a lot of indirect consequences. The number two is that it has also led to motivation and an encouragement to a lot of innovative enterprises to come in the sector. We see that a lot of different aspects, such as things like telemedicine, which was something which a lot of what's not promised and practiced is now getting highly extensively used.
Right.
Number three is that the manufacturing capacity of India, that is
Mhm.
getting silently increased. If I have to give an example, just when the COVID started, we
Mhm.
used to import swabs, collection swabs from India at
Right.
17, sorry, from China at 17 rupees per piece. When we started realizing that there's a very high cost and we will be requiring a lot of swabs, our MSME and our manufacturing industry, it started indigenous production. Today, after
Mm-hmm.
2 months, we are making all the swabs within India, and the cost of that swab is less than 2 rupees. So,
Yeah.
as they say that, it is the crisis which is actually leading to such type of innovation and such type of disruption. I think there are
Mm-hmm.
a lot of indirect positive consequences that are happening through this particular situation, and I think this will indirectly pave the way for the country in a very different direction.
Mm-hmm.
Of course, there would be a different sort of an economy which is also emerging, like we know the digital economy. How a major boost has been given to that. So, in and
Mm-hmm.
all, I think the approach is to first contain the COVID spread. The second would be to make the country COVID free. But parallelly, I think there are a lot of other positive consequences that are also arising. And I think if we talk about this, let's say after 4 5 months, I would probably also give you more dimensions to this particular scenario. But I'm
Mm-hmm.
hopeful about this entire situation getting mitigated in a very short period of time.
Thank you, Varun sir. Now we have a lot of questions. The audience is very much excited, and we have a plethora of questions in front of you.
Okay,
We will be asking the questions which were not covered in this discussion to give
sure.
more dimensions to the discussion. One of the very important questions which was asked by Saisri Akondi is,
Hmm.
could you talk about the data safety measures of Arogya Setu app?
Hmm.
So, anything from your side when it comes to Arogya Setu and the privacy concerns?
Yeah, Aditya, why I'm smiling is because I had also tweeted about how Aarogya Setu is extremely critical, and how the data privacy is one of the main focus area of Aarogya Setu. So let me first just quickly dive into what exactly is the purpose of Aarogya Setu. The purpose of Aarogya Setu is twofold. First
Mhm.
is that it helps individuals understand what is their particular risk severity and what is the risk severity of people around them. So, if I am staying in Delhi, my risk severity is very different. And I am staying in Delhi as compared to, if I'm staying in some far flung area, where my risk severity will be very low. Number two is that it also helps government understand which zones should be defined as a containment zone, which zones are defined as green zones or orange zones or red zones, and that is a very valuable insight, because without the data, if the government randomly keeps assigning the zones, it will be a disaster. So
Mhm.
these are the twofold objectives of that. Now, what Arogya Setu has done is that in a very short period of time, they have made an indigenous app which has been developed by people within India, and which have been stored and which have been maintained by the government itself. I think
Mhm.
Arogya Setu has been very forthcoming. And if you look at the recent development, their entire source code is now out in the open domain. They are using an open source architecture for the entire app. Point number two is that even when there were reports of any particular security breach which could have taken place, I
Right.
must tell here that there was no security breach which took place. But even
Mhm.
when there was a speculation, the Arogya Setu team was very forthcoming in addressing them,
Right.
and it happened within 4 hours, not within 24 hours, but even just within 4 hours. That shows the proactiveness,
Right.
of the agency which is handling this Arogya Setu. Point number three is that within a very short span of time, uh, you know, more than 12 crore downloads have happened for this particular app. Of course, it is not a mandatory thing, but as an individual, I feel much more safe, to know that the area where I'm going, what is the type of risk severity of that. So if we look at all the different components, and the fundamental reason why the whole privacy issue comes into play is that right now India still does not have a personal data protection bill. It has been right now getting discussed in one of the parliamentary committees, and
Yes.
once we get that particular bill, I think a lot of concerns with regard to privacy would be addressed.
Mhm.
And even if you look at the draft PDP bill, it says that during a epidemic or during a pandemic, this particular data with regard to your particular risk severity should be considered as a public good, because you having this particular virus is also affecting the people around you. And
Right.
that's why it is important for the people to know. What is important is that people should know, but there is no particular reason for people to know that this is this particular person. So the
Mm-hmm.
personal details of that particular individual should be preserved, but at the
Mm-hmm.
same time they should know the aggregate severity of that particular area. And that is
Mm-hmm.
exactly what Arogya Setu does. It does not say that Aditya has COVID. It says that someone living in that particular area has COVID.
Right.
So it gives you information. It gives you certain data points, but still maintains the personal privacy of that particular individual.
I think it maintains the message which the lady on our ringtone gives, that
Yeah,
हमको बीमारी से लड़ना है, बीमार से नहीं.
बात से नहीं,
So
बिल्कुल.
that so that
That's
is that is the kind
needs to
of
be important. Yes, absolutely.
one question which Vikrant Bhalera asks is, how important are non-governmental organizations in such crisis situations, and how reliant is the government on such NGOs to reach to the grassroots?
I think when we talk about Corona warriors, they are not only restricted to doctors or the nurses or to the ASHA workers. They also expand to a lots and lots of good Samaritans, who actually come forward and who have actually volunteered. I know about hundreds of good not-for-profits and NGOs who have been extensively involved in the in the management of pandemic through providing very timely relief. I have
Mhm.
personally seen myself volunteers going and distributing food, distributing different sort of relief material like mask, like blankets, like providing shelter relief, and even things like feeding the dogs. So I have seen lots and lots of great NGOs coming forward and working on the ground. And as I said, it is not the government which is fighting this pandemic. It is a country which is fighting the pandemic. And when we talk about the country, it is the citizens, the NGOs, the government, the private sector, every particular stakeholder which resides within the ambit of this country, which is fighting and which has to fight this pandemic. So I think the role of the NGO is very, very critical, and I'm very happy that they all of them have actually stepped up to this occasion.
Uh, uh, from stemming from this question, there was one innovative idea in one of the editorials of the Hindu, that the
Hmm.
government should have sector-based NGO database. So when a
Yeah,
crisis of such sorts happens, the government should empower and give directions, and it should be like a task force. So I remember, this is a very juvenile example, but then I remember a cartoon show we used to watch in our childhood, which was Power Rangers
hmm.
SPD, that the
Hmm.
whole building was consolidated into different departments, and then it became one of the robot to fight different enemies. So I think
Hmm.
government with NGOs should have a mechanism which will be
Yeah.
dormant in normal situations, but which becomes active, and it functions as one huge body in all over the country.
And as a matter of fact, there is a database like that. I forget the exact name. It is either called Disha or something like that, but it's something which has been owned and controlled by, I think, NITI Aayog. Which basically has a mechanism such that the NGOs can register themselves there. And it is also one of the important requirements for their for their functioning, so that they can actually get registered, and the entire engagement can become more structured engagement. So I think there is a database like that, and government has taken efforts to communicate to them, to actually empower them and also urge them to step up. At the same time, what the government has done is that along with various ministries, they have made various training modules, and not only
Mhm.
for healthcare professionals, but even for individual volunteers and even for NGOs. So I think if you just go to to the internet and search for the training modules, you will find a lot of modules which actually entails details that if you want to provide relief, to provide support, what are some of the basic precautionary measures that you should do, what are some of the areas where relief is required,
Mhm.
how to ensure that the volunteers in your NGO, how to
Mhm.
communicate this message to them. So a lot of basic modules have been formulated, but as you rightly said, that this type of engagement needs to be strengthened, and we need to use this particular NGOs on a more and more repeated manner for responses like this. And I think, going forward, that should be one of the primary objective, when it comes to engagement with the NGOs, about how you encourage them and how you constantly empower them.
We'll take last two questions from the audience and then we'll conclude this talk. One
Sure.
question which comes from Aditya Yavalkar is, will government now empower the public health sector as a competitor to the private sector, or are we going completely, are we going to rely completely on the private sector?
Well, I don't think so. Either of that approach has to be done, in a full blown manner.
Mhm.
What we have realized is, after 70 years, that there needs to be a synergy between the public health system and between the private health system. No particular one sector is going to be enough. If you look at, a lot of immunization drives, and if you look at a lot of primary care, that is, offered mostly by the public sector at large, especially in the rural areas. Through different immunization program, through primary healthcare centers, through community healthcare centers, through ASHA workers, a very robust public health mechanism. And when we look at the quaternary levels of care, we see that there is a growing dependence on the private healthcare system, just because of the fact that they have more resources in terms of doctors, in terms of infrastructure, in terms of their reach, in especially in
Right.
tier 2 and tier 3 cities. So I think the idea is to not overshadow or have only existence of one particular sector, but rather have synergies. And that is the model for a lot of sector, not only health but a lot of sectors. Even if you look at education sector, we have seen that there is a good synergy between the private and the public institutions. And I think that also ensures certain amount of competition for delivering better quality of services. And this is what even we are witnessing in the healthcare sector. We are seeing lots and lots of example of public private partnerships happening for opening
Right.
new hospitals, for opening new medical colleges, for delivering medical education. So I think that is the type of an engagement model that India really needs to adopt, wherein the public and private sectors can come together, can leverage their existing strengths. Just to give a very small example, now imagine if the public and private sectors are coming together, and public is leveraging its strength of ASHA workers and primary care, and then
Mhm.
whichever patients require a higher level of care, they are referred to this private sector infrastructure. I think that makes a very good and very robust continuum of care, and
Right.
that is what is really required. And at the same time, there are also a lot of efforts that are happening in creating a digital health infrastructure system, wherein again it has been envisioned that the public and private sector, they need to come together and
Mhm.
devise various products such as teleconsultation, e-pharmacies, different types of medical devices, different types of diagnostics such as digital AI based diagnostics. All those different types of interventions and innovations are happening. So I think the way forward is for not for a public or only for a private, but rather more of a synergy between a public and a private sector participation.
All right. Thank you so much, Varun sir. And this will be the concluding questions for the whole debate. And I think we discussed this earlier this afternoon.
Hmm.
That there have been many questions raised on the timing of China
Hmm.
delaying its response to the COVID-19 virus, or not informing the WHO, US
Hmm.
pulling out of WHO, and
Yeah.
very much developments. But there's another dimension to it which says that China suggested wrong measures of lockdown and not quarantine but lockdown, complete blanket lockdowns, which even China has failed at, as we see that Beijing has been a new emerging center for COVID patients for the past week. So it is being said that what if you have to hold China accountable for something, don't hold it accountable only for delaying the response for a virus, but uh, hold it accountable for suggesting the wrong kind of public policy of complete blanket lockdown. What are your thoughts on this?
Well, I think when we talk about China, we have definitely seen a lot of, delays and fault lines which have appeared. One is definitely, number one is there, they reprimanded the doctor who actually alerted the country about a new sort of a virus which was actually getting, transmitted. Number two is that they definitely had a delay in informing the WHO as well as the global community about
Mhm.
the type of spread which was happening. So of course, there is definitely some sort of a fault with regard to the reporting mechanism, and there needs to be some sort of an accountability measure. Uh, Earlier also, I have said that we need to have some sort of an international treaty and international framework. Just like we have with regard to let's say different types of nuclear interventions. We
Mhm.
also need to have such type of interventions with regard to the outbreak of a pandemic,
Mhm.
which ensures that the country, whenever it detects a particular pandemic, has to report on a real time basis to the global community, because it is no the world is so interlinked and interconnected that no longer it is a backyard problem for a country, but it is a global problem. So of course, we need some major interventions in that particular part. With regard to your second point that China suggested wrong measures. Uh, of course, as I said before, that when we talk about the lockdown, when we discuss the lockdown, uh, there would be very differing viewpoints with regard to
Mhm.
whether the lockdown was required or not.
Mhm.
And again, it just comes down to measuring the efficacy of lockdown through facts and figures,
Right.
and depending on whether that country required a lockdown or not. So, if I have to give an example of, let's say, if there are a few Nordic countries which have a good health infrastructure, and wherein the viral load is relatively less, probably they don't require that type of lockdown. But for a
Right.
country like India, which has 135 crore people, and which requires certain time to actually prepare, we need a lockdown. And that lockdown, it really helped us in terms of getting that extra time to prepare ourselves. So, with or without China, I think we need to, actually look at the lockdown as one of the intervention and gauge its effectiveness. Of course, the timing of the lockdown, again, as I said, 60 days, 75 days, 40 days, that is
Mhm.
something which is up to a lot of discussions and debate, and that should be done. But, as a policy intervention, whether it is a binary answer that whether it's a required or not, I think
Mhm.
it was. So I think on that particular aspect, I particularly feel that India did the right thing. And with regard to China, taking that accountability, I think it has to take some sort of an accountability. Whether it does or does not, I think it's the impetus of the global community which needs to enforce that accountability.
All right. Thank you, Varun sir, for joining us and giving us your valuable time for this interview. I mean, it was so refreshing to hear someone from the government speaking so expansively on different types of issues. I mean, we have seen like press conferences of different health secretaries and people from the government, but your perspective, because you are relatively young compared to people from the government, and you have worked in different fields, right from international relations to now domestic health sector. It was very much refreshing to see this kind of scrutiny which you took upon yourself, and still answered point to point about this is point one and point B. I have noted down these points in my notepad because these were very valuable, not just as a host but as a person who has been studying national policies and who will be studying national policies for a very long time. Thank you so much for the time.
Thanks a lot, Aditya. Your questions were, very focused, and it is always great to have a discussion, because in the current age, wherein we have so much access to the social media, it becomes really tough to actually understand what are the facts and figures and what is the noise. And that's why we need to constantly keep having these discussions, especially with the young people, so that they can have access to right information, so that they can make right decisions. Also, I must congratulate the VIT Pune MUN team for actually showing to the entire MUN community that it is not only about organizing one particular event in 1 year and then staying dormant, but it is more about the continuous engagement of the theme and
Absolutely.
of the development issues that you believe in. And I think it's a great initiative that the entire team has taken. I would really hope that other MUNs and other organizations and other student societies also take similar type of initiatives, because the idea is always to inform and empower the young people so that they can make the right decisions. Also, Aditya, thank you for asking me such great questions. I have been also following your Instagram, which is the Bharat Bhagya Vidhata. I really like the type of content and the type of information that you put out. It creates a lot of positivity with regard to different issues. So I really enjoy the commentary, and I would also urge all the viewers to follow both VIT Pune MUN and Aditya's channel and Instagram page. I think what you guys are doing is simply fabulous, and we need more heroes like you and the entire VIT Pune MUN team to take forward this movement.
Thank you so much, sir. Thank you, all the viewers, especially for joining us in such a large number, as well as asking us very pressing questions into different regards. We did not take a lot of questions because we had taken those subjects in our discussions previously, but then the questions which were unique, which could bring dimensions, were taken up. So, thank you, everyone. Thank you, especially to you, Varun, sir, for joining us.
Thank you. Thank you. It was great talking. Thanks.
Yes.